Okay, hello, good morning, everyone. I am the chair of the board, and I call this July meeting of the King County Regional Homelessness Authority Governing Board to order. Thank you to the Seattle Public Library for hosting the in-person location today. We begin every meeting by grounding ourselves in our theory of change, which reads, if we create a homelessness response system that centers people with lived experience of homelessness, then we will be able to respond to needs and eliminate inequities in order to end homelessness for all. Next up, we have our land acknowledgement. We acknowledge that King County is located on the unceded traditional land of the Coast Salish peoples. We honor this land and its people, past and present, and we are committed to directing funding and resources to organizations led by and in support of Native and Indigenous people. Thank you all for being here. Afyang, will you please take the roll call?
Yes, Chair. Member Kim?
Here.
Chair Wilson?
Here.
Member Aviva? Member Backus? Member Barone?
Here.
Member Bracken?
Present.
Member Fain?
Here.
Member Foster?
Here.
Member Hay?
I'm here.
Member Jiang?
Here.
Member Prince?
Here.
Member Rink? Member Robertson? Chair, we have quorum with 9 members.
Okay, great. We have quorum with 9 members. So next up, we have our consent agenda. We have one item on the consent agenda, and that is the approval of our June 2026 Governing Board meeting minutes. Is there a motion to approve the June 2026 minutes?
So moved.
Okay, and is there a second?
Second.
Okay, the motion has been moved and seconded. All those in favor, say aye.
Aye.
Aye. Okay. Any opposed?
Aye.
Okay, the consent agenda has passed. Thank you. Okay, next up, we have our monthly CEO report from Dr. Kelly Kinnison. Kelly, take it away.
Thank you, Chair. Hello, everyone, and members of the public joining us. I want to start by congratulating some new board members of our Continuum of Care board. Afyang has a slide with their names and then a slide that has our complete COC board for 2026. And very pleased to have increased our representation in all of the seats and sectors that HUD likes to see in our NOFO response, Notice of Funding Announcement response. We actually do get scored on the composition of our COC board. And here you can see that we have maintained very strong lived experience members in this governing body. We've also added elected officials, law enforcement, business, and providers, and a funder to our board. So really look forward to working with them, as I know you all do as well. Thank you, Afyang. The other COC update I'd like to share with you today is related to our 2026 funding process. So as folks know, King County and a coalition of local governments and nonprofit organizations filed a federal challenge to key provisions in the 2026 Continuum of Care Notice of Funding Announcements. The objections relate to the limits on permanent supportive housing renewals and the Tier 1 protections that they currently have, as well as several new eligibility and policy conditions of receiving funding. The states are asking the court to invalidate these provisions and require HUD to conduct the competition without them. The plaintiffs have requested expedited relief, including a preliminary injunction. The court has already established an accelerated schedule with briefing to conclude July 31st and plaintiffs requesting a ruling by August 10th. That is also the day when we are scheduled per HUD to make our local ranking list public. So we are continuing the competition under HUD's current requirements with the August 26th deadline, while preserving our flexibility to respond quickly to any court order. So juggling a number of things, but we have great partners and a great team standing ready to adjust as we get information from the court. And with that, we have a number of other items that would normally be part of the CEO report on our agenda. So I will stop there and turn it back to you, Chair.
Okay, thank you, Dr. Kinnison. Next up, we have public comment. If you are here with us in person, please sign up to comment with Afian. And if you are providing comment via Zoom, please raise your hand now and you will be called in the order received. Each commenter will be able to speak for 2 minutes. Commenters will hear a bell when they have 30 seconds left, and virtual commenters will be muted when their time is up. Public comment will be open for 15 minutes or until no others would like to speak, whichever is sooner. We do ask public commenters to please keep your comments related to items within the board's purview. Afian, will you please open the public comment?
Chair, we have no one in person and no one online, so I believe we can close public comment.
Okay, thank you. In that case, we will be moving on to our briefings. And first up, KCRHA leadership will provide an update on the Corrective Action Plan.
Thank you, Chair. I'll be providing the update on our Corrective Action Plan. Our 60-day report was sent out earlier this week. And the central message of the 60-day report is that KCRHA is moving beyond sort of responding primarily to forensic evaluation items and moving into a phase of being more involved in the sustained work of financial stabilization and organizational improvement. Overall, the CAP 60 reflects a transition from those sort of specific individual corrective action items that we've made good progress on, as you'll see in the report, and then integrating those activities into this broader financial stabilization effort. Most of the work streams are now recurring management processes rather than one-time deliverables. Major milestones since the 30-day report. I'm excited that Alan Chaffee and Natalie Zier from Turning Point Strategic Advisors are here with us today, and we've been thrilled to have them on board as the embedded support, bringing really notable capability and capacity to our financial work. And the embedded engagement is now fully engaged. They're doing a great job with us, providing implementation support, validation, additional finance capacity, and just generally the immediate focus is helping us stabilize our financial operations, strengthen internal controls, support reconciliation work, track corrective action progress, and build the financial baseline needed for HUD readiness and an orderly transition of county and city contracts that's taking place later this year. Other milestones are that our historical cash accounting and accounts receivable reconciliation reached a significant analytical milestone. We completed that work up to the end of 2025, and it's providing an important foundation for statements of our 2025 financial statements, which will be completed here in the coming weeks. And we're excited to be engaging with Turning Point on that work to roll that forward to the 6/30 so that we have a really current understanding of exactly what the baseline financial situation is relative to that. And then we're seeing continued advancement of governance and internal controls, policy framework, and Finance Committee. We met yesterday, and it's been great to have the Finance Committee kind of find its footing and moving forward. What we've learned is that the reconciliation has really improved our understanding of those historical receivables, administrative funding, financial reporting, The work increasingly demonstrates that historical issues were the result of accounting, reconciliation, process complexity, rather than any sort of single underlying cause. And as we conduct the next phase of review with Turning Point, we will be able to have more detail pretty soon on the outcomes of that. Sort of what's next for us is finishing our 2025 financials, continuing the validation of the reconciliation results, and advancing administrative sustainability planning, the remaining CAP milestones in preparation for the 90-day report, and a lot of work that's related to the changed landscape for future state KCRHA that was not known when the CAP was originally put in place. I think I just note it's been an intensive effort across staff, leadership, finance committee, the city, the county, Turning Point. Just grateful for everyone's support and leaning in on the work. We've made measurable progress, and importantly, we're building the governance, financial management, internal control disciplines, the things that are needed to really support KCRHA over the long term. And I'll stop there in case anyone has any questions.
Okay, thank you, William. And I see Board Member Barone's hand.
Thank you, Chair Wilson. William, I appreciate the work that KCRHA has been doing on the CAP and addressing the issues that were identified in the forensic evaluation. I wanted to ask you if you could elaborate a little bit on the issue of the $8 million in receivables. The couple questions on that point. So one is the 60-day report mentions that it says preliminary results indicate that historical accounts receivable balances were materially overstated and that a significant portion of the historical balance will require accounting adjustment. I realize that this is still ongoing work, but as I read that, I think I understood it to mean that so when we're talking about receivables, we're thinking of money that we assume is owed to KCRHA. I read that to mean that we now think that that money is not owed, that we thought it was owed, but now we're discovering that it wasn't owed. It says a significant portion. Could you talk about whether I'm not sure how to read that? Is that like more than half of the 8 million? Can you elaborate a little bit on that? And then the second part of the question is that the report says that there's it's delayed and revised schedule on that. Could you give us a sense of what that revised schedule? I did not see a timeline on that, and if you could address that a little bit.
Yeah. Member Barone, thank you for those questions. And I will choose my words very carefully because I've noted that it's really important to be particularly clear. Obviously, a couple of things about the $8 million in unreconciled receivables is how Clark Nuber articulated their understanding. We never received any of the materials, the work product from Clark Nuber. So we've been leaning into trying to understand what that actually is. And as you noted, an unreconciled receivable could mean that it's money still owed to us. But there are other ways that those numbers could have accrued on our financials. And as we've moved through this reconciliation process via the cash accounting process, which just gave us a really sort of relatively quick and high-level ability to understand what was going on there, our understanding of that has evolved. And we know that it's possible that there are funds in there that are still owed to us. It's also likely that it could be related to accruals that weren't backed out properly. That would be an example of sort of the accounting adjustments that might need to be made. Where we are now is we're excited to have had our internal team complete that process through the end of 2025. And now with our Turning Point partners here, we're leaning into that whole review of what we've done and then together advancing that work through to June 30th. We anticipate that revised schedule being completed in the coming weeks. And at that point, then we will be able to offer more definitive understandings of what is exactly composed and what the total dollar amount may be. It may be more than 8 million, it may be less than 8 million. We are still determining that. And then finally, I would note that you're correct. If it's adjustments that are being made, that does not have a material impact on our cash position and would not reflect monies owed to us.
Thank you.
You're welcome.
Anyone else have questions? Okay, I see Board Member Foster's hand.
Thank you so much. And I just want to ask a follow-up question. I heard you say it's possible that it's related to accruals that weren't backed out properly. Can you just expand on that a little bit more?
Yes, I offered that as an example of one of the many types of technical accounting occurrences that are quite normal in terms of, how a large organization handles its books. Sometimes they might need to make journal entries. Accruals are typically estimations of future payments and receivables that might need to be anticipated during a closeover period, of usually at the end of the year into the next year, or at the cessation of a contract, but yet the final invoices haven't been received. And so you might put a number on the books that anticipates what's going to happen with those. And then later, what happens may be different than your anticipation, and you might need to adjust that accrual. And then also, as part of the process, that accrual gets fully codified into the books. It's one example of a number of different types of accounting adjustments that can come up in these kinds of situations. And happy to have Alan or Natalie offer more context on the different types of accounting adjustments that could conceivably be part and parcel of this. But I think we're going to have a really much better understanding of what is actually going on in our experience here in a few weeks.
Thank you. And I want to just follow up with this a little bit. What I think I hear you say is it's possible that some of this might be related to putting on the books sort of anticipated amounts or potentially pledged amounts, and then not reconciling what was on the anticipated or pledged and then the actuals, and that may be accounting for some of the missing 8 million. Is that what I'm hearing?
Yeah, I think that's a reasonable
layman's summary.
Yeah, exactly. But like just noting, that's like one of 4 or 5 different things in the accounting world that could cause some of these balances to be unreconciled and unresolved and sort of accumulating. And as Clark Nuber noted in their evaluation, it was the result of many years of layered multiple sources of things that caused this unreconciled receivable balance to be there. I'd Alan, if you had any extra comments that you thought might be useful, I'd be open to that.
I don't know if I have comments. I'm open to questions. I think you explained what we reviewed William's team's reconciliation on a Zoom call earlier this week, and we're today having a meeting with their director of finance to actually give us the data to go through and validate it and then begin the roll forward.
Got it. I look forward to hearing more. And I know this has just been, and thank you, Member Barone, for opening the questions on this, because I think this has been one of the most important kind of ongoing parts of the work. So I appreciate that.
Thank you all. Any further questions? Okay, hearing nothing, we are going to move on to our next briefing, 2026-06. KCRHA Jordan, Senior Director of the Ombuds Office, will be presenting a 2025 Ombuds Office Snapshot. She's joined by Raphael Hartman, Assistant Director of the Ombuds Office, and Dolores Hillis, Director of Housing at Solid Ground. KCRHA, take it away.
Great. Can you all see the PowerPoint presentation and my screen? Awesome. So good morning, chairs and members of the board. My name is KCRHA Jordan, and I serve as the director of the Ombuds Office. I appreciate the opportunity to be here today to highlight the impact of our work and provide a snapshot of our 2025 data, which will be available in our annual report in August. Before we begin, I would like to recognize my colleague, Raphael Hartman, who serves as the Assistant Director of the Ombuds Office. Raphael partners closely with me in leading an exceptionally talented and diverse team. The work highlighted today reflects the team's commitment, expertise, and dedication to serving this community. I would also like to recognize Dee Hillis, the Residential Services Director for Solid Ground, who will be sharing her experience with the Ombuds Office. So as you listen to today's presentation, I hope you leave with 3 takeaways. 1, the Ombuds Office has become a trusted and essential resource for the homeless response system. 2, the Ombuds Office strengthens accountability and drives system improvement. And 3, the need for an Ombuds Office function will remain regardless of how homeless services are structured. So why is an Ombuds function important? The Ombuds Office fills a critical gap in the homeless response system by providing a place where people can seek guidance, ask questions, and raise concerns when they don't know where else to turn. The Ombuds function also reduces administrative burden by helping people identify the appropriate resources, facilitating communication, and resolving concerns early, often preventing issues from escalating into formal complaints or grievances. We also serve as a collaborative partner to providers. Our goal is not to assign blame, but to help identify solutions, strengthen communication, and improve trust across the system. Finally, the Ombuds Office represents an innovative model and a demonstrated success of a regional approach. Ombuds offices are common in sectors such as higher education, healthcare, and even child welfare, but they remain relatively uncommon in homeless response systems. I believe we are one of 4 Ombuds offices in the nation that serve people experiencing homelessness. So by establishing this office, our community demonstrated a commitment to increasing transparency, accountability, and continuous improvement across the entire system. So whether someone is experiencing homelessness, enrolled in a housing program, working for a provider, or is a community member at large, they need to know there is a place where they can speak openly and be heard without fear that their concerns will be dismissed. So in accordance with KCRHA's interlocal agreement, the Ombuds Office is responsible for 6 core functions. These responsibilities include gathering feedback and data, resolving concerns, investigating complaints, and recommending improvements to services and operations. They reflect the work we do every day within our defined scope, which includes responding to and addressing issues related to program administration, service delivery, policies, and other activities overseen by KCRHA. Those core functions provide the foundation for our work, and on the next slide, I'll discuss what this looks like in practice. So when a community member contacts our office, we follow a consistent process regardless of the issue being raised. We begin with an intake and screening to gather information about the concern or complaint. We then assess the nature of the issue to understand what the individual is seeking and determine whether the matter falls within our scope of work. From there, we identify the most appropriate resolution pathway, whether that involves providing information, facilitating communication between participants and providers, connecting someone with another resource, or conducting a more in-depth program or external review. Once the appropriate resolution pathway has been completed, we monitor progress on any recommendations, document the outcome, and close the matter. We also continue to track inquiry data, identify trends and recurring themes, and look for opportunities to improve the system. So that said, the resolution pathway we use to address an issue depends on the nature of the concern being raised. Those 4 pathways include information and referral, assistance and facilitation, external review, or a program or department review. For instance, some people contact our office and only need information or referrals to resources. Others need assistance with understanding program policies and services, or with resolving communication issues with the provider. When concerns fall outside our jurisdiction, we complete an external review and help connect individuals with the appropriate oversight agency. For more significant concerns involving KCRHA-funded programs, we may conduct a program or departmental review and elevate the issue to the appropriate department for further action. While we do not provide direct services, housing placement, or case management, we serve as an administrative resource to help people navigate concerns and identify the appropriate pathway to resolution. This approach allows us to tailor our response to the nature of the concern while ensuring individual concerns receive the appropriate level of support, oversight, and review. So now that I've described how we respond to inquiries, I'd like to shift to providing a snapshot of some of the data we collect. This slide presents the total contacts we received and responded to from 2022 through 2025. As you can see from the slide, the number of contacts increased from 113 in 2022 to 536 in 2023. This represents a 366% increase in the number of contacts, which is a direct result of our office going from 2 to 5 staff in 2023. Now, growth continued to 616 contacts in 2024 and 631 contacts in 2025. While year-over-year growth has stabilized, current numbers show that the increase from 2022 to 2023 was not just a temporary spike, since the numbers from 2023 onward remain above the 2022 baseline, indicating that the office has been able to retain a higher level of engagement. With that said, keep in mind that an increase in the number of contacts does not necessarily mean the numbers of problems has increased. The increase could be due to greater awareness of the Ombuds services or expanded outreach efforts. So while the previous slide showed growth in the number of contacts we receive, this slide provides a closer look at the types of cases those contacts represent. So our office addresses 3 types of cases: complaints, concerns or comments, or requests for system support and facilitation. So what we can gather from this data is that the majority of our work continues to involve system support and facilitation, which highlights the importance of helping people navigate at an administrative level a complex homeless service delivery system. This data also highlights that complaints increased to 155 in 2025 and almost 50% increase from 2024, which may indicate that people increasingly trust the office to raise complaints, or can simply be a reflection of us continually to improve our process, such as how people submit complaints through our web form. And then concerns and comments also continue to grow, providing valuable information about emerging issues. However, the takeaway from this data should be that this mix of case types demonstrates that our role extends beyond investigations and includes education, navigation, facilitation, and problem solving. So looking at the data from another angle, this slide categorizes cases by providers who have contracts with KCRHA and those who don't. The data shows that most complaints and concerns involve service providers, while cases with no agency involvement primarily involve requests for system support. It's worth noting that many complaints involve providers that are not funded by KCRHA. However, from the perspective of people who contact our office, these providers are all part of the same homeless response system, regardless of funding source. For most people, the distinction in funding or oversight are less important than getting help with an immediate concern. So as a result, they bring those concerns to the Ombuds Office even when they fall outside of KCRHA's direct oversight. So while the Ombuds Office, we do our best to help with these kinds of cases, our ability to investigate or resolve issues is more limited when a provider is not subject to KCRHA's oversight. So these cases also highlight a gap between how the system is structured and how people experience it. This will become an even larger issue now that oversight responsibilities are shifting across the homelessness response system, which raises an important policy question for the governing board to consider. Should the Ombuds Office's jurisdiction be expanded to respond to complaints involving all homeless service providers, regardless of funding source or administrative oversight? So while case data tells us how people are using the Ombuds Office, it doesn't tell us what concerns are driving those contacts. So in 2024, the Ombuds Office began tracking qualitative data from our web form submissions. In reviewing the narrative answers to our web form, we learned what type of issues were trending for each quarter in that particular year. Listed are the most common issues named by program participants, providers, or community members who contacted the Ombuds Office. While not listed in order of frequency, resource requests, facility issues, staff issues, and exit issues continue to be our top issue categories. These categories help us understand not just how people are contacting us, but what challenges they are encountering within the homeless response system. So behind each of those concerns brought to the Ombuds Office is an opportunity to improve service delivery and support those accessing the homeless response system. While we often work with individual concerns, the impact of our work extends beyond a single case. To highlight a few examples of how the Ombuds Office contributes to system improvement, we've seen our work result in improved provider responsiveness to grievances. So for example, one emergency shelter provider for years had required participants to submit their grievances through postal mail. After discussion and feedback through the Ombuds process, the provider recently changed to an online grievance form, which greatly increases accessibility for someone experiencing homelessness. In another case, a provider worked with the Ombuds Office to strengthen their grievance process to help prevent issues from escalating and strengthening their ability to address complaints at the program level. These are just two examples among many, but it has been encouraging to see providers actively revise their grievance processes and other program policies as a result of their engagement with the Ombuds Office. We have also seen the impact of the Ombuds work result in stronger relationships with providers. As one provider recently shared, while receiving a call or email from the Ombuds Office can sometimes signal that a challenging situation or a complaint needs to be addressed, I've consistently found the Ombuds team to be collaborative, professional, and solutions focused. The Ombuds Office serves as an important role in the homeless response system by providing an impartial space for concerns to be heard while also helping providers navigate difficult situations. So to hear this directly from a provider is especially encouraging because when the Ombuds Office first was established, there was a perception that our role was primarily investigative or punitive. Over time, we have worked to help community members understand that our goal is to be a fair, impartial resource that helps all parties identify opportunities for improvement and help resolve concerns. And I believe the provider's feedback that I just shared really reflects that shift. So with that, I'll turn it over to Dee Hillis, Residential Services Coordinator at Solid Ground, to share her experience working with the Ombuds Office. And I'll stop sharing my screen so that you can see Dee.
Okay. Thank you, Katara. Good morning, board. My name is Dee Hillis, and I serve as the Residential Service Director at Solid Grounds Sandpoint Campus in Magnuson Park, where we operate 183 units of permanent housing and permanent housing with permanent supportive housing for families and individuals. I also oversee 10 units of emergency housing for families in the Crown Hill, Ballard, and Magnolia areas in North Seattle. I appreciate the opportunity to share my experience working with the Ombuds Office over the past 5 years. During this time, I've worked closely with Mary Dunbar and her supervisor, Raphael Hartman, to address resident concerns and support housing applicants in understanding Sandpoint's eligibility requirements. Because our service models are complex, applicants sometimes need additional guidance to understand the nuanced differences, the eligibility requirements for both the permanent supportive housing and the permanent housing with supports. And to understand the documentation that's needed for each of those programs. With support from the Ombuds Office, applicants have been better able to navigate this process and understand the requirements. So they're not just hearing it from me at Solid Ground, but here's a neutral party. And ultimately, as a result of the ombudsman's support to the individual, we were able to work through all the requirements and house the family. The Ombuds Office has also participated in our annual community-wide health and resource fair, providing residents and the broader community members with an opportunity to meet the Ombuds staff directly and learn about available services and supports. Mary and Raphael have provided consistent and meaningful support to Solid Ground and to the residents we serve. The Ombuds Office has been an important resource for individuals seeking to raise concerns and participate in a fair review process, including in situations where they may disagree with the outcome. Mary has demonstrated skill in asking thorough and thoughtful questions that allow her to understand both the residents' perspective and Solid Ground's position. Through virtual meetings and written correspondence, we have worked collaboratively to resolve a range of issues. I've provided her with information about our policies, our grievance process, lease information, all in an effort to support a more positive and constructive outcome for the client. In one notable situation, a resident was engaging in rude and aggressive behavior towards staff while asserting their rights were being violated. Despite multiple efforts by the Solid Ground staff to address the matter, explain the rules, and do all of this in a respectful and collaborative way, the resident's conduct continued, and the resident subsequently filed a grievance with the Ombuds Office. Solid Ground provided thorough documentation of our efforts to clarify the policies and expectations for residents living in subsidized housing. Although the resident did not initially accept our explanation, the Ombuds Office played a key role in helping to redirect the situation. Ultimately, the resident acknowledged the Ombuds Office conclusion and moderated their behavior towards the staff. As a result, the resident was able to maintain their housing by complying with the paperwork and compliance requirements and interacting with staff in a more respectful manner. I've also consulted with Mary and Raphael regarding specific resident issues and concerns in an effort to identify appropriate solutions. I think the Ombuds Office, as well as Solid Ground, has been focused around the best solution, the best outcome to create win-wins for both the resident and the staff. In addition, I've shared our grievance process with the Ombuds Office and authorized them to distribute it to other agencies that may benefit from using it as a template or as a source of guidance. In summary, I value the Ombuds Office role in promoting clear communication, fair processes, and constructive problem solving among residents, applicants, and service providers. Thank you for your time and consideration.
Thank you so much, Dee, for sharing your experience with the Ombuds Office. We are incredibly grateful for your partnership. So looking ahead, one of the lessons we've learned is that many concerns brought to the Ombuds Office do not fit neatly within the responsibility of a single provider, program, or agency, because they often reflect broader system challenges. This creates the opportunity to further strengthen the Ombuds function as a system-wide resource, ensuring there remains a trusted impartial avenue for raising concerns and identifying trends, and helping the system learn from the experience of the people it serves. So as we think about what it means for the Ombuds function to play a clearer system-wide role, The Ombuds team has begun developing key performance indicators that are intended to help us answer two critical questions. One, did we perform our role effectively within our scope? And two, did the system respond meaningfully to the issues identified by the Ombuds Office? In doing so, we hope to move beyond simply counting contacts and cases and instead establish measures of awareness, engagement, responsiveness, and system learning. Another area of focus for the Ombuds Office is continuing to strengthen grievance practices across the homeless response system. During 2024 and 2025, we interviewed 81 program participants across program types and received feedback from 24 provider surveys. Drawing on those perspectives, the Ombuds Office plans to publish a grievance guidance report in the fall of 2026, along with a one-page guidance document that providers can use as a resource to evaluate their current grievance process. So I'll close with this. Regardless of how homeless services are structured or funded, people will continue to need somewhere to go when they have concerns, need help navigating services, or want to raise issues safely. The Ombuds function fulfills that need by providing an impartial and accessible resource for program participants, providers, and system partners. So that concludes this presentation. Thank you for your time and the opportunity to share this information with you.
Okay, thank you so much, Katara and Dee. Are there questions for the presenters? I see Board Member Fain's hand.
Thank you very much. I wanted to start by thanking the Ombuds Office in general for their very thorough responses. I've received a couple both from folks asking the questions and then just generally being CC'd on things. And Mary in particular in the Ombuds Office has done a fantastic job of providing a lot of information for complaints or concerns or issues outside of KCRHA's jurisdiction. So that goes to some of what was covered in the presentation. And thank you for meeting with me outside of this and walking through some of this. But I wanted to, for everyone else's benefit, talk a little bit about the number of cases that are unrelated to KCRHA or outside KCRHA's jurisdiction, and the types of cases those involve. So as I understand it, cases or questions that the Ombuds receives that are outside of KCRHA's jurisdiction are largely support and system facilitation questions. And I think you're probably pulling up page 13 or 14 with the charts.
Really quickly. Okay.
So we see a large percentage there, 91.73, and I think those are largely the system support cases. What I would love to see, and I think that might help us get to an answer of what you're asking, which is how can the Ombuds Office provide more meaningful overall support to the homelessness system, is if you could provide the actual number of annual the annual number of complaints. So for each year, how many complaints fell outside of the jurisdiction versus those that fell inside, and then also the types of cases that you're receiving, whether they're concerns, complaints, or actually people who really do need help. And you don't need to do it now, but if you could share that later, I think that would be helpful.
Yeah, absolutely. So we have the number in terms of contracted versus contracted cases, and I can provide raw numbers for you and breakdown, but we only have those numbers for 2024 and 2025, because that's when we began actually tracking this data point. In terms of the type of cases, I can provide you with that information since our inception in 2022. So I will definitely follow up with the board and provide the information that you requested. Absolutely.
Thank you.
Okay, thank you. And I see Board Member Barone's hand.
Thank you, Chair. Tara, thank you so much for the presentation, and Dee, thank you for your being part of this presentation as well and the work you're doing to serve our unhoused neighbors. Katara, I wanted to ask you on I think the approach that you've all taken, I think makes a lot of sense in terms of being kind of partners and trying to resolve questions. And I think Dee presented a good example of a situation where somebody who didn't find like they were getting a resolution through the agency, having an independent, entity like the ombuds come in and review something and tell them that like the agency was correct is good, and help that person kind of recognize that they were kind of in the wrong in that situation. But I wanted to ask you what tools, how much authority does the Ombuds Office have, and what happens in a situation where you actually find that, let's say, obviously we appreciate all the work that providers, but there could be a situation where the provider is in the wrong and is doing something wrong. What are the tools that the Ombuds Office has? Does that become kind of a contract enforcement mechanism that KCRHA would then come, hypothetically, if there's like a discrimination issue that's kind of sustained by the ombuds, could you talk a little bit about what the authority is and what that process would look like?
Yeah, absolutely. So this is part of the reason why I spoke about it's important, right, for us to get clear on oversight in terms of these contracts. So when we face a significant issue like the one that you raised, and it's within our scope, right, service delivery, program administration, policies, or other activities overseen by the authority, if it's a KCRHA funded organization, we will do something called a program or departmental review, which is essentially a fact-finding process and investigation, right? So we will talk to all the parties, we will document everything, right, that we hear, we will develop findings and recommendations, and we submit those to our internal program monitors, right, to follow through with those recommendations with a particular provider. We can do that, right, with KCRHA contracts because we're able, that is something we have oversight over. Now, with those non-contracted cases, when they present a serious issue, the only tool we really have is an external review. So we can have conversations with individuals, we document them, but then we have to forward kind of what we're documenting, for example, either to the county or the city. Often what happens there, though, is that because we don't have oversight, we don't see those contracts. We often don't know what happens, right, after we forward those particular complaints or cases to the county or city or some other entity. Often it's not until the original complainant reaches back out to us saying, hey, we haven't heard a response, what's going on, that we have to often determine, okay, how do we help assist this person in getting back to, the right oversight agency? So in terms of investigations, we are limited, right, to KCRHA funded organizations. Now, what we do try to do as much as possible is really try to resolve things informally before they get to the point of needing to do a formal investigation. So we do have situations, right, where there are like conflicts between providers and a complainant, and we'll do our best to like either do mediation or something so it doesn't rise to the level of a program review. So for example, if you think about 2025, we had 155 complaints. Not all of those were program reviews. Maybe 20 or 30 of them might have resulted in a formal investigation, right? And so we still are doing our best to, navigate and resolve conflicts before it gets to that point. But that is really the only tool that we have because we don't have enforcement power. All we can do is really do the investigation, document it very clearly, and share that with, our internal program monitors to follow up on.
Thank you.
Okay, thank you. Any other questions? I'm going to call myself. Thank you for all this. This is super helpful. I'm wondering, I can see like a lot of ways that the information that is learned through the Ombuds Office and through these processes could be really helpful. I'm wondering what kind of, is there kind of a systematic process for getting feedback from the individuals who are making complaints about how they feel the process wound up for them? Like, do they feel like their issue, whatever it was helped or resolved, or they got kind of what they needed and from the Ombuds Office? Is there that kind of systematic gathering of feedback? Obviously, you're not going to be able to, make everyone happy, but it seems to me it would be useful to have something like that. So does that exist?
Absolutely. So when I talked about the KPIs that we're developing, one of the things that we want to start tracking better is resolution and follow through. So through kind of that KPI development, we hope to be able to do more of that kind of formalized feedback gathering from community members. What we do track, however, is case outcomes. And we feel like that is a better track, a better measurement than looking at resolution rate, because there's so many things within supporting people navigating homelessness, right, that are outside of the Ombuds control. Particularly, are we able to provide a housing resource, right? And if a housing resource doesn't exist, of course, someone is not going to be happy with that. So we do track outcome data. So for example, was the issue resolved through KCRHA? Were we able to provide a housing resource? Was it outside of our scope? But we do hope to be able to track that a little bit more systematically once we have our KPIs going and rolling, because we do think that is an important, right, feedback mechanism for, hey, is the Ombuds Office doing what it's supposed to do?
Got it. Thank you. Okay, any further questions on this item? Okay, if not, then thank you again, KCRHA and Ombuds Office. Really appreciate your joining us today, and we're going to move on to our next item, briefing 2026-08. Oh, sorry, yeah, the last one I said the wrong number. So this will be William Toey, Associate Deputy for Strategy, will be presenting on the Regional Services Database. William, take it away.
Thank you, Chair. I'll share my screen and begin with rolling through the slides related for this. And just quickly noting that the Regional Services Database is a full data set of the entire homelessness response system, regardless of funding source, contract holder, or whether it's, a church-based program in a neighborhood or a permanent supportive housing building that's, part of a much larger system. The Regional Services Database has been around for years. It's part and parcel of the HMIS overall platform. What's exciting about this updated version is, as the technology improves across the data hub that's paired with our core HMIS data, we're beginning to be able to do it in a geographically located format, which is different than the previous versions, which were basically spreadsheets and nowhere near as easy to use or as helpful and functional. Also, the previous editions were static, whereas this is actually integrated into live data with the HMIS system itself. So as the system changes, so does the tool displaying that. We have completed the soft launch. It's just gone live on our website. We've spent about a month showing this with people, having working groups, and we're pretty excited about how this tool, which is really just a comprehensive, updated, user-friendly way available to the public that everybody can use regardless of the reason why they might want to access it. And you can see some examples here of reasons why people might find the tool useful. It's helpful in a variety of different ways. I won't go into all three of them, but you can understand that would be useful in those cases. Key features, over 400 programs are outlined here. It's driven in part by the housing inventory count, which is an annual requirement for HUD. It tracks various features and aspects of each of the programs. The new tool allows us to begin to do really helpful things like integrating with other data sources. So, for example, bus routes are now integrated and layered into the tool, and the new display mechanism features easier ways to understand and review and access the data relative to the previous editions with the spreadsheet. The data primarily comes from the HMIS system, also our housing inventory count. This is where we pick up a lot of the programs that aren't in HMIS. We estimate over 90%, 95% of the system countywide is now utilizing the HMIS system, but there are outlier programs that do not participate, and the housing inventory count enables us to keep updated on those. So these tend to be live data. Then we also are informed by service contracts and other understandings of the underlying contracts related to some of the programs, and then the outreach workers. Also, the new system has got the really nice feature to be able to quickly submit updates or corrections as you're using the tool. So we get a steady stream of inputs that come through as particular locations perhaps change the set of features that they might be offering. Maybe they introduce meals or they cease doing meals, things like that. The data that's presented is protected quite clearly. We do provide the actual address for some locations. Other locations, we use an approximated address, and then providers can specify which way they would like that to be. And then in other cases, we do not include the program data at all. An example of that would be for domestic violence or gender-based violence programs. They just simply aren't listed in this directly for geolocating. It's not a replacement for coordinated entry. Coordinated entry is a system that's specifically for access to permanent supportive housing units and rapid rehousing programs in a general sense. It does not replace 211. It is a useful way to look at the full landscape. This is a little dated. It is updated on our site. We are at version kind of 1.5 at this point. And I'm going to just hop over to the actual tool now and give us a quick run through on this. And so you can follow along on our website. If you go to the website, it's Find Services, and then you'll see a link to Regional Services Database. But essentially, you know, you can see that you can do the kind of things you'd expect with the modern technology today, where you can begin to understand what's available within the broader system. Then you can use filters to select different types of services. And so, for example, if I was in downtown Seattle, perhaps, I might want to come in here and I might say to myself, I'm looking for a day center. So I'd click the day center, and I can see that there's a few different kind of walk-in day centers that provide different varieties of services, but I'm looking for one that perhaps has hygiene because I want to take a shower. So I would click on the hygiene as well, and I quickly realize, oh, okay, there's a service here. It's the Urban Rest Stop in downtown. It's got information about the program right here that would be useful for someone. You know, you can click on the website for the organization. And again, every time you see one of these pop-ups, there's an opportunity to submit feedback on that. I would just then note that the ability to select for other services is really useful. So for example, if I was looking for a tiny home village, I can again kind of scroll out and see the entire population is 22. I can move back in and understand where they might be located. I can click on one here. This will be Olympic Hills. I can understand the mechanics of what's going on there. There's 45 units. Who is it serving? And again, if I want more information about accessing that, I can access the website there. It's important to note that the only integrated countywide methods of single point of access are for coordinated entry to permanent supportive housing and rapid rehousing. For general shelter services, the providers often have their own methods and practices for determining how people can access shelters. That being said, we're excited about future versions of this One of the other elements that's been coming online this year with the HMIS updates includes a live inventory capacity. So future versions of this tool would be able to integrate the ability to see where there may or may not be open beds available at shelters within the system. And then you'd have a link to be able to go find out how you might go about accessing that shelter. But again, noting there's no centralized system for accessing shelter at this point. Another thing I'd note about this that's kind of useful is, and you can kind of see it here even, I'll just stay on the tiny homes, in that one of the things we have been working on for understanding a regional approach to the homelessness response system is the idea that there could be a core services baseline where no matter where an individual is experiencing unsheltered homelessness in King County, that there would be a baseline set of services that would be available to them within a reasonable geography. And so, for example, you can see if I click on emergency shelter, there's quite a good spread of those services across the landscape. If I instead go to day centers, we'll see that that's really predominantly located in the downtown metro area, and that there in fact is a sort of a deficit of services in some other areas. And day centers are a good example of a relatively, I think, a very cost-effective intervention that is a really useful way to engage folks who are experiencing homelessness in relationship and provide the sort of ability to build that relationship and trust to facilitate accessing other services that are available. Additionally, you can access this by different sort of settings. And so, for example, if I wanted to look at this by city council districts, I can go ahead and select District 5, and I can just kind of come in here and see what's in District 5. And then if I wanted to, I can go up here in the corner and export that into a CSV file. So it's a really useful way of putting the data out into the entire community to help people understand the overall arc of our homelessness response system, the different types of services and features that are available, and being able to quickly engage with the opportunity to learn more about those services. I'll stop there and welcome any questions folks might have.
Thank you, William. Do we have any questions? I'm not seeing any hands. Okay, great. If there is no questions or discussion on this presentation, thank you very much. And next we are going to be moving into executive session to discuss matters related to RCW 4230-1110 subsection 1. As presiding officer, I'm announcing that we are slated to be in executive session for 30 minutes until 11:36. If the executive session is to be extended beyond that time, I will announce the extension and the expected duration. And following the executive session, the meeting will adjourn. Executive session begins now. So governing board members, please leave this call and join the Teams link that Afyang has put in the chat, or that Lisa has put in the chat. Okay, see y'all in a minute. Let's see. How many more people are we waiting for here? Two.
Just one.
Board member Fain should be joining shortly.
Without her, we're stuck here forever.
I let her know that. Good. She's having trouble with the link. I'm trying to help her.
Sorry, everyone. I was having trouble getting back on.
Okay, wonderful. Well, that brings us to the end of today's meeting, unless anyone wants to introduce new business, please don't. Our next meeting will be on August 28th, 2026, from 10 a.m. to 12 p.m. Is there a motion and second to adjourn?
I move to adjourn.
A second.
Second.
Okay, all in favor of adjourning, say aye.
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 Okay, any opposed? Okay, let's get out of here. Thank you all, and we'll see you next month.